So three very important questions when it comes to the fatty liver. One is, who should find out if they have a fatty liver? Because, the thing is, one third of the people, they don't even know they have a fatty liver. And, the 50% of the people who actually have fatty liver, they actually have a normal liver function test, right? So the routine liver function test can completely miss it. So let's see who need to get tested for the fatty liver early on. And the second is, does it only happen in like a heavy set, like obese people, or can it happen in the skinny people also? And third, is it really a fat issue, or is that something else, So let's talk through that. So I'm Dr. Singh. I'm a functional medicine doctor, owner of the Functional MD's Clinic. It's a functional medicine clinic in Carmel, Indiana. So let's talk through these three questions. Number one, who needs to be tested, right? Routine blood testing can miss, the fatty liver profile. Obviously, there is like a FIB-4 scoring. There is, elastography you can do, or the FibroScan. There are all those things. But who need to be more vigilant, right? That's a basic question. Anybody with a metabolic syndrome, high blood pressure, high cholesterol, visceral fat, especially the fat around the midsection, they need to make sure, right? They don't have a fatty liver profile, because you want to act sooner before it gets irreversible, right? Before it damages the liver permanently. Okay. Number two is it a fat problem? Is that happening? Many people think the fatty liver happens because of the fat we have in the diet. Not true. Okay. It is more of an insulin resistance problem than the fat problem. It's the carbohydrate, the high fructose, corn syrup, processed food, ultra processed food. The carbohydrate intake is more important than that. Okay. And the insulin resistance overall. And number three, does it happen in the fat people, or can it happen so it can happen in the skinny people as well, very, very commonly. And this is where those are the people, they don't pay attention to that. They feel, oh, they're fine, they're not overweight. But then this is why the regular weight can be so deceiving. That's why I highly recommend always check a body composition analysis, to see how your visceral fat is, how the body fat is, the BMI and the total body weight can be so deceiving, okay? So it can very much happen. The visceral fat, the fat around your organs, the midsection fat, that's bad. Goes to the liver directly. Poison to the liver, guys. All right? I'll see you later.